Alright, so I'm knocking on the patient's door. I've gathered all of my equipment and I'm ready to proceed with the head-to-toe exam. I'm going to wash my hands. I'm going to introduce myself and tell the patient what I'm doing. My name is Allison. I'm going to be your nursing student today. I'm going to do a head-to-toe assessment, okay? And then I am going to raise the head up, raise the whole bed. I'm going to lower the side rail. I'm going to observe the patient's general appearance. She seems calm. I'm going to look at her. I'm going to assess whether she's in any distress, assess her mood and her affect. Then I'm going to assess her vital signs. So I'm going to get her blood pressure, I'm going to do her pulse ox, and do her heart rate, monitor her respirations, and then I'm going to check her temperature and heart rate, blood pressure, respirations, and then we do a pulse ox. She is not on any oxygen, so her pulse ox is 99 room air. And then we're going to ask her whether she's in any pain. Are you in any pain today? No? Perfect. So then we are going to calculate her ideal body weight and her body mass index using her height and weight. Then we would move on to her mental status. So we would ask if she was oriented, if she knew where she was, who she was, why she's here, and what today is. And that would assess her orientation to person, place, time, and situation. And so she is alert and oriented times 4. And then we are going to observe her posture, her body movements, her facial expressions, her speech, and her cognition. She answered all of my questions appropriately, and her speech was not slurred, so her cognition is there. So then we're going to assess her skin. So we're going to do that throughout the examination, but we want to assess the temperature, the texture, any color variations, any edema, any lesions, and I think that's it. So then, let's see, then we would teach a self-skin exam. After that, we want to move on to the head. So we're going to inspect and palpate the head, noting the consistency, distribution, and color of the hair. It's evenly distributed, the consistency is thick and like a dirty brown, dirty blonde. So after we do the hair, we're going to move to the face, and we're going to look at her face. We're going to palpate her temporal arteries. They're +2 bilaterally strong, so that's great. And then we're going to, can you smile? Yeah, and can you puff out your cheeks? Can you show me your teeth? Right, can you frown, like a sad face? Oh. And then can you raise your eyebrows? And can you squeeze your eyes tight? Great. So her cranial nerve 7 is intact. And then we would go ahead and we would Alright, so then we would go ahead and I'm going to look at your eyes. Get down your level. So I'm going to inspect her eyes. We're going to assess her visual acuity with the Snellen chart. I'm going to look at her sclera. Her sclera is white. Her conjunctiva is pink and moist. Pupil size is, let's say, 6 millimeters. So I'm going to get you to look at my light, look at my nose. All right, and pupils are equal and reactive to light and equally reactive to light and accommodation. I'm going to get you to follow this pen light, okay, into accommodation. So then we are going to, hold on, after we do the perla, we're going to do the ears. So I'm going to check her, I'm going to inspect her auricle, her tragus, and her lobule. And then we're going to ask her if she has any hearing aids. Do you have any hearing aids? No? Do you have any issues hearing? No? Okay. Then we would perform the whisper test and have her repeat the words that we whispered to assess her hearing. So after we do that, we're going to go to her nose. We're going to take a look at her nose. And her nose is an external nose. There's no discharge, no septal deviations. Then I'm going to inspect the patency of her nares. So breathe in, both nares are patent. We're going to inspect the internal nose with the otoscope, and then we're going to inspect the mouth, the lips, the mucous membrane, the buccal mucosa, the soft and hard palates, the tongue, all pink and moist. There's no lesions noted. The uvula is midline. Can you say ah? All right. There's no tonsils visible. We'll just say +1. I would check the gag reflex, which will assess cranial nerve number 10 at that time. So then we're going to move on, and we're going to take a look at her neck. So with the head of the bed elevated to 35 degrees, I would assess for JVD, which is jugular vein distension. And there's no JV noted. I'll check the other side. No JVD noted on that side. So then I am going to palpate the carotid arteries. I'm going to palpate the carotid arteries. Sit down. He's okay. Sit down. And then sit your head up. I'm going to palpate the trachea and the thyroid gland. Can you swallow? All right. And the thyroid gland is not enlarged. If it were enlarged, we would auscultate at that time for bruits. I'm going to go ahead and take a listen to her carotid arteries. So I'm going to listen on this side, and I'm going to have the patient hold their breath to listen to the carotid arteries. Just listen for any bruits. None of those were noted. So then we're going to assess the range of motion in the neck. So I'm going to have you tilt your neck to one side and the other side, and then touch your head to the chin. Perfect. So the range of motion in the neck is good. So then I would inspect the upper extremities. The muscles are fine. There's no atrophy noted. The skin temperature is warm and dry. There's no lesions, no edema present. There's no atrophy noted. Can you do the grip? Can you squeeze my fingers? I'm going to assess the grip strength. Perfect. I'm going to assess capillary refill at time. That's brisk, less than 3 seconds. I'm going to go ahead and have her flex her elbows. Range of motion in her elbows is good. Flex her wrist in and out on both sides. Range of motion in her wrist is good. And then your fingers, can you straighten your fingers out? Fast. Thank you. Okay, do your opposition of your fingers, testing your finger range of motion. Great. And then from there, we are going to address skin turgor. So I'm going to just pinch there. There's no tenting noted for her skin turgor. It's brisk. So then we're going to go and we're going to inspect the chest wall anteriorly and note her respirations. They're even, unlabored. The chest rises and falls symmetrically. Let's see, we're going to auscultate the lung fields. So auscultate all of those. All right, and the lobes are clear. There's no adventitious lung sounds noted. All right, so then I would auscultate the heart. So I'm going to go ahead and listen at the aortic point, the pulmonic point, the Erb's point, tricuspid point, and the mitral point. And I would do that with the diaphragm, and also I'd go back through the aortic, pulmonic, tricuspid, Erb's point, tricuspid, mitral, and listen with the bell of the subscope for any murmurs. Then I would go back to the apical pulse and palpate that. I would also take that for 1 full minute, and then I would palpate the point of Mags's impulse, and I can feel all of that. So then I would have the patient sit up, and we're going to auscultate the posterior lung fields, and all of those are clear. There's no adventitious lung sounds heard. We're taking a note to look at the back, and their skin is warm and dry. There's no lesions. No breakdown or redness noted on the back. And then we'll do the T9 chest expansion. Sit up. Thank you. So take a deep breath. Great. All right, like that. So the chest expansion is about equal. Stop, sweetie. So then I'm going to have the patient lay back down, and we're going to check out the abdomen. What was your last bowel movement? When did you last go potty?
Like Sunday and Monday.
Okay. And is that normal, or do you normally go every day? Yeah. Okay. So I'm going to inspect the abdomen. I'm going to The umbilicus is midline, there's no deviations, it's retracted, there's no distension noted. So then I would auscultate the abdomen in each area, in each quadrant for 1 full minute, starting with the right lower, right upper, left lower quadrant. And I would listen for a full minute, and then if bowel sounds are active, I would listen for 5 minutes. So the bowel sounds are active in all 4 quadrants, and then I would palpate. So I'd palpate here, there, and then there, and there's no masses or tenderness noted. All right, so then moving right along, we would go and then we would address the legs. And so the lower extremities, there's no abnormalities. The skin is warm, dry throughout. The hair is evenly distributed. See, there's no edema noted. Got a bruise there. There's no edema noted. Let's go ahead. Can you flex your knees up to your chest? All right, so the knees have good range of motion. And can you pull up, pull up, pull up. All right, push against, push this way. Thank you. All right, so the can you pull down? Try to straighten your legs out. Pull down, perfect. All right, pull up, push up. All right, so the motor strength is good in the lower extremities. It's equal on both sides. So we do capillary refill in the toes. That's brisk, less than 3 seconds. So then I'll have the patient hop out of bed, and can you walk there and back?
The guy's foot?
Yep, and turn around. All right, so I'm just observing her gait. Turn around, close your eyes. We're gonna do a Romberg test. Just checking for any swaying. There's a negative Romberg test because she has minimal swaying. Can you lean down and touch your toes? All right, so I'm gonna inspect her spine. There's no spinal curvatures, no abnormalities noted. The hip range of motion is good. It's over 90 degrees. Can you sit up for me, sweetie? All right, so we've done the Romberg, we've done range of motion, and we've observed your gait. So then can you lay back down? Okay, all right, so let's see. Is there anything that I forgot? All right, so then at this time I would turn the patient to the side and we would inspect the anus. If there was any stool present, go ahead and look at the bony prominences on the posterior side. There's no redness noted, no skin breakdown, so turn back over. If it was since it's a female, we would inspect the perineum, the labia majora, the pubic hair, and the mons pubis for any abnormalities. If this was a male, we would inspect the penis, the scrotum, and also from any femoral or inguinal bulges, which would indicate their hernias. And we would also teach a testicular self-exam if it was a male. Since it is a female patient, we also want to inspect the breast tissue, the nipples, and also the areolas. We would palpate the breast tissue and the axilla, and we would teach a breast self-exam for the female. If it was a male, we would only inspect the breast tissue and palpate the breast tissue and the axilla. Is there anything else that I can do for you today?
No.
Awesome. Okay. Well, thank you for letting me do that. I'm going to lower your bed back down. I'm going to raise your side rail. I'm going to wash my hands, and I'm done.